Hello and good afternoon. We are here live, and today we are talking about ear tubes and ear infections and getting surgery for that. And we are here with one of our ear, nose, and throat specialists, Dr. Knecht. Dr. Knecht, thank you for joining us.
Sure, it's great to be here.
So tell us a little bit about you and your background and what makes you an expert on this topic.
Sure, so I did ear, nose, and throat residency in Loma Linda, California. That was a 5-year residency, and then I did a 1-year fellowship specifically in pediatric ear, nose, and throat. That was at the University of Michigan. And then I have now been working in Dayton Children's Hospital.
Okay, awesome. So this is obviously a very popular topic. I think that I feel like every kid gets an ear infection at some point. I have a 5-month-old daughter. She just had her first ear infection last week. So just kind of starting down that track. So kind of talk to me, how common, I feel like every kid gets an ear infection, but realistically, how common is this?
Well, just to speak to that a little bit, ear tubes are the most common ambulatory procedure in the United States. If you did kind of a general pooling of all patients, 1 in 15 will need ear tubes at some point.
Okay.
And if they are in daycare, unfortunately, that risk is twice as great. And so for a lot of us, our kids are in daycare. We don't have a lot of choices. And that can become even a bigger risk.
Right. Yes. And that's what my daughter is in daycare. So we're definitely dealing with that. So, okay. So let's talk about tubes specifically. And we're going to go through some fact and fiction related to tubes and questions parents might have. Okay. So the first one I have here is fact or fiction. My child will never have an ear infection again once tubes are put in.
I wish that I could tell you that was true. It would make everyone happier. But unfortunately, children can still get ear infections even after having tubes put in. I do get that question a lot from a lot of parents. The one thing that I like to reassure them is that even though they can still get ear infections after an ear tube, there are several really good things. The first is that when your child has an ear infection now, it's probably kind of confusing. It's hard to tell, are they teething? Are they just have a cold? What's going on? Once they have an ear infection with an ear tube in, you'll see drainage from the ear, and it'll be much easier to diagnose. And then there are a lot of evidence that actually, even though you can still get ear infections, they're a lot less frequent.
Okay. Well, that is good to know. So, okay, so let's go on to the next one. So, fact or fiction. Let's see, which one do we want to do here? A child must undergo general anesthesia to get tubes put in.
Good question. So this one is a fact, but there's a few caveats to it. So they do have a general anesthetic, but it's different in a few important ways. It's actually just a mask, and it's inhalation. They don't have to be intubated, and they don't get an IV or intravenous drugs like you would think with some other types of general anesthesia. But they are completely asleep, so they do not feel any of it.
Okay. And I know that can be scary for parents, even, because my guess is that for a lot of families, this is probably the first surgery or first time that a child has to go under is having ear tube surgery. Is that what you find?
Yeah, very frequently. Ear tubes, like you were mentioning with your daughter, kind of the first time that I often see parents are kind of in the 6 to 12 month age range. That's when their ear infections start. And so you're right, this is often the first time they're having to think about a surgery or a procedure.
Okay. So fact or fiction, though, ear tube surgery takes 10 to 15 minutes.
Yeah, so that is true. It depends. But yeah, usually my part of the procedure takes about 5 minutes, and then the rest of that 10 to 15 minutes is the anesthesia team working on making sure that they go to sleep and wake up.
Okay. So talk to me about, and I'll just say to those who are viewing right now, thank you for joining us. If you have questions for Dr. Knecht, feel free to write them in the comments and we will answer them live. We would love to know what questions you have about ear tubes and ear infections. So talk to me a little bit about what are ear tubes? What are you doing when we say you're getting ear tube surgery? What is happening? What are you actually putting in there and how is it helping the situation?
Yeah, so that's a good question. I'll start with a little bit of background about why we need ear tubes, or what caused the problem. So what happens is, in babies, they have a tube that connects their ear to their throat. It's called the eustachian tube. And in babies, it's not very well developed. And so it will often collapse or close off, and then pressure builds up behind the ear.
Okay.
So that's, in the middle ear space, right behind the eardrum. Then fluid can build up, and that fluid gets infected. For some kids, the problem is that fluid never goes away. For other kids, the problem is that fluid goes away and comes back and keeps coming back and forth. So that's why we need ear tubes. And then ear tubes themselves, you make a small incision in the ear canal. That's done all through the ear canal with a microscope and special instruments. And then the tubes, there are about as many different types of tubes as you can imagine. But they're all made of some type of plastic. Some are made out of metal.
Okay.
But all of them are usually round or oval and then have a hole through the middle that serves as an escape valve kind of for the ear so that the pressure can equilibrate.
Okay. So we have a question here from the audience. This is from Jessica, and she wants to know, can a child still have a current ear infection going on and still have surgery?
Jessica, that's a great question. I get that one a lot from my patients. The answer is yes. As long as their lungs are clear and that wouldn't interfere with the anesthesia, the best treatment for an ear infection is actually putting in an ear tube. Because I can actually suck out that fluid and that infection right away during the procedure.
Okay, great. Thanks, Jessica, for typing that question in. So, so you already talked about that they're made of potentially metal or plastic, kind of different materials. Let's talk about this one. Fact or fiction, the hole made in the eardrum from the surgery will not close.
So that one is variable. For the most part, fiction, but it can happen. So what happens is, as the eardrum heals, it will pop the tube out. And that usually happens about 6 to 18 months after we place the tube. The risk of there being a small hole behind when that pops out the tube, it doesn't heal completely, is about 2%. So it's quite low, but there are occasions where there's still a small hole left in the eardrum.
And is that anything to be concerned about for parents?
Yeah, the great news is, for the most part, it's nothing to be concerned about. If it does cause drainage from the ear or hearing concerns, there are many different ways to fix that, ranging from putting a small patch over it to actually rebuilding the eardrum if necessary. And your ENT would be able to do all of those procedures if needed.
And how would you know that it didn't close? Is that something that like you're doing a regular follow-up, then you would be able to see that, or a pediatrician would be able to see that?
Yeah, great question. So follow-up is different depending on the doctor that put in your ear tubes. But specifically here at Dayton Children's, we see you once a year, and that's to make sure that the tube is doing what it should be doing, that it falls out. So we will see you once a year until the ear tubes have come out and we know that your eardrum.
Okay. So let's talk about, we got another question earlier on Facebook that I think is probably a very common question. And this person said, will my toddler always need to have his ears covered in our pond even after his tubes come out? And, you know, we can just talk about fact or fiction that kids have trouble going swimming after tubes are put in. So let's just talk about that.
Yes, this is probably the most common question that I get from parents. So first of all, I guess let's talk about water when you have tubes. It sounds like that patient's question was more about after.
Yeah.
But the current recommendations published by the American Academy of Otolaryngology are that you don't need to use earplugs when you are swimming with tubes in place. You can swim in a pool, bath, all of that is fine. That being said, occasionally I'll have patients who it seems like the temperature of the water is bothersome to them. So
Okay.
they'll have tubes, they'll get in water, and it'll seem to irritate them. In those specific patients, I do tell them they can use an earplug or something to protect the ears, but most kids don't. Um, After the ear tubes have fallen out, your eardrum should heal over completely and go back to kind of its normal function. So even if you've had a history of ear tubes, as long as the eardrum has healed, absolutely no problem. You can scuba dive, you can do a lot of those things um, just like you would have normally before.
Okay. Thanks. So then another question we got on Facebook earlier was from Stephanie, and she wanted to know, why is it recommended to remove adenoids when a second set of tubes is needed?
Yeah, this is an advanced question. The reason is that the adenoids are lymphatic tissue that's at the back of the nose, right where you remember we talked about that eustachian tube earlier, that tube that connects the ears to the throat. It empties into the throat right at the back of the nose where the adenoids are. And so when you have very large adenoids, they can actually obstruct that tube and be a big part of why the child is having recurrent ear infections. So we use that second set of tubes as kind of a sign that there's more going on. And so we also address the adenoids at that second surgery.
Okay. Okay. Let's do another fact or fiction. Tubes typically stay in the ear for 6 to 18 months.
This is true. That being said, that's an average number. Unfortunately, tubes can fall out sooner than that. I see that a little more frequently if there's an infection or something else that happens, and they can fall out a little earlier. Also, tubes can stay in longer than that. And that's another reason that we keep an eye on our patients. If tubes stay in really long, like longer than 3 years, there is some evidence that there's a higher risk of leaving a hole behind when they fall out. So sometimes we'll start talking to you about removing the tubes if they've been in there for a really long time.
Okay. So speaking of them removing or falling out, we have fact or fiction. Surgery isn't necessary to remove ear tubes. They will fall out on their own.
True for most children.
Okay.
But yes, that small percentage of kids where they've been in longer than 3 years, then sometimes we do need to go in and remove the tube surgically.
So, but that's pretty uncommon.
Very rare, yep.
Okay. And then I think our last kind of fact or fiction, we kind of talked about this, but just to reiterate, is fact or fiction, ear tube surgery is relatively safe and common.
Yes, I would say overall that is very true. It's certainly the common part, like we had talked about a little earlier, the most common outpatient surgery in the United States. And safety as well. There are, several things that make ear tube surgery safe. The fact that the child is under anesthesia for such a short period of time is a big part of that. And that it is really just a single incision. So the risk of getting an infection or complication is quite low as well.
Okay. Is there a youngest age and oldest age that you do tubes for?
No. Our patient populations, I often do ear tubes in very young children who have cleft lip and palate. And the reason is that cleft lip and palate, the associated thing that caused the lip also causes the eustachian tube not to work. And so they often have fluid behind their ears. So I usually am doing ear tube placement in cleft lip and palate kids around the age of 3 months.
Okay.
They do very well with it. And then, no, certainly older people, unfortunately, can get fluid behind their ears, get ear infections. When I was in residency and I worked on adult and pediatric patients, we would often do ear tubes on our veterans at the VA hospital.
Oh, interesting.
The good news, or the difference, I should say, with adults is you can do ear tubes in the clinic setting for them.
Oh, okay.
They're much more tolerant. You can actually put a general or a local anesthetic, on the eardrum and insert the tube in a clinic setting, which we cannot do in our pediatric patients.
Right. Wow, I didn't know that. Interesting. Is there a limit, you know, how many times you would do tubes with somebody, or?
That one is a little bit more complex. I suppose the true answer is there's not a hard and fast limit. After I have put in 3 sets of ear tubes, I do start to worry a little bit about the health of the eardrum after the tube placement. Every time we put in a set of tubes, the eardrum heals, but it heals in a slightly weakened way. In fact, this may be something else for parents to know. Once you've had a set of ear tubes, often your pediatrician may comment that they can see the scar tissue from the tube. And that can be true. You can see kind of a white plaque or a white color to the eardrum where the tube was placed. So the only thing I start worrying about as we do more sets of tubes is about a weakening of the eardrum over time with tubes over and over. And then, of course, I worry just to make sure we're not missing anything, that a diagnosis isn't different. So after a few sets of tubes, I look at a few other things.
Okay. Well, this has been a great conversation. Is there anything else I didn't think to ask you that you want to make sure that parents watching this know?
I think you've hit a lot of the really good highlights. Thanks for hosting. It's been a great privilege to talk to parents about ear tubes and about their children's ears. Yeah, I can't think of anything else. I think we hit all the highlights.
Great. Well, thank you so much for joining us, and we hope that this is helpful. If you're watching and you have additional questions after this broadcast, feel free to still write them in the comments, and we can get with Dr. Knecht and respond to those in type later on. So we appreciate you joining us, and we hope that everyone has a great rest of your week. So have a good day.
Have a great week.
Bye.